do that is because people learn best when they are enjoying themselves. If I am coming to open a textbook and I'm talking to you, you will not grab as much as you should have grabbed as a young person or somebody working for a young person or somebody targeting a young person.
But how about to look at it from this point of view? Look at it from this point of view for the benefit of everybody within the community. So you are educating them based on the knowledge that you have, but you are not sidelining or criticizing their own point of view as a whole. Then you have public demonstration. You carry microphone about and say, sexual violence is not good. Stop beating your wife at home. Ensure that your children go to school. Different issues that we can use public demonstration to advocate for. Then we also have media engagement. Going online, we've had different types of mediums or media that we can use. The print media, the television, the radio, social media, Instagram, TikTok, WhatsApp. All of these are media tools that we can use for engagement.
The first thing is to conduct a need assessment. In this particular community that I am, what are the gaps that they're experiencing in sexual and reproductive health? Once I'm able to decide that, then I know who should be my target for this. I'll have to conduct an analysis on that also to determine my target audience. Then after that is looking into the strategies that I will employ. Am I going to make use of outreach? Is it the social media I want to use to pass my message? Is it using of questionnaires and all those stuff? So these are the things I'm going to do.
A lot of young people are not aware of their rights and they are actually quite misinformed. And this should actually not be. So this workshop has actually helped to re-emphasize the need for young people to be aware of their rights, rights to life, rights to education, rights to even comprehensive sexuality education, things that would actually help them in making informed choices, informed decisions that would help them in navigating through life. So another major thing that this workshop has also re-emphasized is a lot of young people are not informed about life building skills. And these are skills that will help them as they go through life. What are some of these life building skills? We have refueler skills, time management skills, goal setting skills, negotiation skills.
And in the course of the program, I've learned a lot of sexual reproductive health and rights. Before we used to have all these ideas, how we're brought up, when they touch you, you get pregnant, anything but sex. But today, I was well educated on what sex really is and how to teach our young ones. We are being taught to catch them young, to be exposed to the real truth that they really need to know about sex. Everything about sexual reproductive health, so that they will not miss it. And as we see that today, young people out of school getting pregnant because they don't have adequate knowledge that they need to know on sexual reproductive health and rights. But today we're able to have more idea and insight on what is really all about. And there have been a lot of misconception on this issue. What is causing all this misconception? Lack of proper education is there, poverty is there, religious belief, traditional belief, culture and norms, all encompassing. But today now we have to ensure that media is being engaged to pass out the right information on sexual reproductive health and rights. We have to catch
I must say that the program organized by HC initiative has been very enlightening, very shared insight as regards sexual and reproductive health. Importantly, they gave us insight into what individuals, young persons, what the media can do, or what government can also do in trying to see that we can combat this issue of child abuse, rape, and sexual reproductive related cases. Interesting also, many things that we're going to be doing as an organization is that we're also going to be leveraging on media tools to create content, whether online also publications. Interesting also that for us as an organization, we're also working with national institutions, alright, in local communities, low-income communities, to also see how we can forge collaborations around trying to also sensitize young boys and girls, adolescents generally. But I think one of the important part that we need to work on also is the challenge of data, alright, which is very important. Confidentiality and privacy is also an issue, and if we must also combat this same issue. There's a challenge of cybersecurity attacks, so the government will need to also come in so that we also build strong infrastructure. Alright, the legal framework around the Nigerian Data Protection Regulation also must be strengthened better to see that data of anonymity is also protected, data is protected for both patients and people who want to access health, sexual and reproductive services. Thank you.
Now we talked about implementation of policies that are already in place because of differences in the belief system. For instance, the leadership do not have that political will to drive the policies that they've signed into as a country. Nigeria is a signatory to CEDAW, Nigeria is a signatory to all international conventions that are fighting for the rights of the girl child, and yet the implementation is very, very difficult because majority of our leaders are also still not, some of them are even perpetrators of this. So they know the implication of the law and they are afraid of being caught by what they are proposing. And that is why some of them are not in support of the implementation of the Child Rights Act, implementation of the CEDAW and the VAP that is in place. So that's why we see this limitation in some of the states that are yet to pass these laws. The majority of these cases that are coming up are the government, the police and the like used to push people to go and settle out of court. Some of the survivors of these cases also, they have families and extended families who will gang up and say the perpetrator, the survivor should stop because families have come to beg. But the ones that get to our table that we can count and we have prosecuted are 17. There is need for a collective responsibility, multi-sectorial approach. Government, healthcare providers, civil society, communities, parents and young people should come together and act, just like what ACL's initiative is doing right now in Ondo State. Communities need social reconditioning. They need social orientation about their rights and about sexuality education. What they don't have, they cannot give. Government needs to put systems in place, policies, procedures, to safeguard the girl child, to promote and increase their access to reproductive health services. Parents need to be empowered to be able to talk with their children. Civil society organizations need to even move more resources to support the efforts of government in creating awareness and counseling, psychosocial support for our young people. So it's not one-way approach. It has to be a multi-sectoral approach. And that's why ACL is building the capacity of the civil society, non-governmental organizations, faith-based organizations in Ondo State to work in collaboration with the government to ensure that the society have a youth-friendly approach in meeting the unmet needs, especially the reproductive health needs of our young people.